Anti-immune hemolytic anemia is an uncommon group of disorders that can occur at any age. These disorders affect women more often than men. About half of the time, the cause of autoimmune hemolytic anemia cannot be determined by idiopathic autoimmune hemolytic situations. Autoimmune hemolytic anemia can also be caused by or occur with another disease, such as systemic lupus and erythematosus, and rarely does it follow the use of certain drugs, such as penicillin. Destruction of red blood cells by autoimmune antibodies may occur suddenly or it may develop gradually. In some people, the destruction may stop after a period of time, whereas in other people it persists and becomes chronic. There are two main types of autoimmune hemolytic anemia: warm antibody hemolytic form of hemoglobin found predominantly in fetuses, which decreases the number of red blood cells becoming sickle-shaped. Therefore, it reduces the frequency of sickle cell crises. Bone marrow or stem cells from a family member or other donor who does not have the sickle cell gene may be transplanted in a person with the disease. Although such transplantation may be curative, it is risky and recipients must take drugs that suppress the immune system for the rest of their lives. Genes therapy, a technique in which terminal genes are implanted in precursor cells, that is, cells that produce blood cells, is under study. Prenatal diagnosis and counseling are available for couples who know they are at risk for having a child with sickle cell disease. Fetal cells obtained through amniocentesis can be directly examined, and the presence of one or two copies of the sickle cell gene can be accurately determined. Hemoglobin C disease occurs mostly in blacks, affecting 2 to 3% of blacks in the United States. A person must inherit 2 copies of the abnormal gene that causes the disease in order to develop it. In general, symptoms are few. Anemia varies in severity. People who have this disease, particularly children, may have episodes of abdominal and joint pain, an enlarged spleen, and mild jaundice, but they do not have severe crises as occur in sickle cell disease. Hemoglobin SC disease occurs in people who have 1 copy of the gene for sickle cell disease and 1 copy of the gene for hemoglobin C disease. Hemoglobin SC disease is much more common than hemoglobin C disease, and its symptoms are similar to those of sickle cell disease, but much milder. Hemoglobin E disease affects primarily blacks and people from Southeast Asia. This disease produces anemia, but note none of the other symptoms that occur in sickle cell disease and hemoglobin C disease. Thalassemias are categorized according to the amino acid chain affected. The 2 main types are alpha thalassemia, the alpha chain is affected, and beta thalassemia, the beta chain is unaffected. Alpha thalassemia is most common in blacks. 25% carry at least 1 copy of the defective gene, and beta thalassemia is most common in people from the Mediterranean area and Southeast Asia. Thalassemia are also categorized according to whether a person has 1 copy of the defective gene, the lacemia minor, or 2 copies of the detected gene, thalassemia major.
I wonder how, what's the word, how objective that is. Seems like they say the defective genes are from Asia and for black people. How,
Well, I assume that it's scientifically found that that's so. I mean, all these countries have
well, they
medical
used
journals.
they used to say you can see a black person's skull is inferior, and they'd measure with the phrenology.
Well, that's completely different from this. To me, this would be some conclusion from a laboratory.
Yeah, I mean, that's what they said it was scientific when it was phrenology. So.